Hello, everyone. I am Jillian Mason, and this is Medicare for All, the podcast for everyone who needs healthcare. Today, we're talking Medicaid, folks. That's the public healthcare system that is meant to be our social safety net for anyone who can't afford private insurance and doesn't have access to healthcare from an employer. I'm sure that most of you are aware of Medicaid, but what you might not know is just how many of our friends and neighbors land in that safety net every year. Over 20 million people in this country rely on Medicaid, the Medicaid program for basic health care. That's 20% of Americans, or 1 out of every 5 people you meet. That means that even if you are not on Medicaid, the $880 billion in cuts to the program that were just proposed by Congress and are being pushed through right now, they're going to affect you or someone you love, and not in a good way. In fact, just today, researchers at Yale and UPenn, they released a new report that states that the Trump cuts would cause over 51,000 additional deaths for Americans every year. For this episode, I'm joined by an organizer for Popular Democracy to really just break it down and talk about why we all need to care about stopping the cuts and how we can act now before it's too late. Jaron Benjamin, I am so excited to have you here. Jaron is the Deputy Chief of Campaigns for Popular Democracy, which is a progressive organization based in Washington, D.C. Jaron, thank you so much for being here.
Thank you so much for having me, Jillian. I'm really excited to dive into it.
This is awesome. Obviously, it's the Medicare for All podcast. We really believe that telling stories is really what changes people's minds. And so whenever we meet a new organizer, and I think that you're new to the podcast, right? I think this is your first time on.
Yeah, first time.
First of many, I am sure, unless I do something really terrible. So let's work on keeping it chill. So whenever we meet a new organizer on the podcast, though, we always want to know how you got involved and how you started doing this work and how you became passionate about this issue. So can you just tell us a little bit about yourself and how you came to be here today?
Yeah, so I first started in this field working. I was a college student and got really involved in an organization called Men Against Violence, where basically what we were doing was talking to men about men's violence against women and other folks. Also talking to white people about white people's violence against people of color, and talking to straight people about straight people's violence against members of the LGBT community, right? So, and a lot of, basically everybody in that organization, we were in two places. One, we were all involved in the Feminist Majority Leadership Alliance, which I thought was great. The other thing is that we all worked at that student health center. So we, we kind of saw those things going together, right? We thought about really fighting the patriarchy would build healthy relationships, and that there was like this inextricable link between that and wellness. So after that, I went and I worked for Acorn when I lived in Dallas, and worked for a lot of organizations like that. Eventually moved to New York to work for an organization that is now Vocal New York, which was started by Jennifer Flynn, who may or may not have been on this podcast before, but who you are no doubt familiar with. So I worked there, and I was the HIV and AIDS and housing organizer. So organized both of those spaces, and it was the first time in my 20s where I was leading healthcare campaigns, and it was a lot of fun. I moved to New York and just kind of had to learn the system there. Then after that, I ran an organization called Met Council on Housing, which was all about, at the time, just like looking at rent stabilization laws. I kind of shifted the focus to talk about the intersections of housing and healthcare, because those are key, and that's something that I picked up in working in the HIV world. And then also talking about people who are unhoused. But again, the continuum, looking at how healthcare impacts other things and vice versa, how something like housing can impact healthcare. After that, I worked for Housing Works.
Housing Works, right? Yeah.
So I was vice president for advocacy there for almost 10 years. I think 7 or 8 years. That's when I worked with Popular Democracy to start the Bird Dog Nation. We put together the 60 city blitz where Jennifer and I and somebody else that worked for me went to 60 cities in 60 days and trained 1,000 activists to stand up and fight against the repeal of the Affordable Care Act. We were successful. And then eventually made my way to Popular Democracy, which has been a lot of fun. And the organizations that I worked with, what is now Texas Organizing Project, was Dallas Acorn back in the day. As a matter of fact, my old boss from when I was there actually just stepped down recently. And Vocal New York are both members, or two of the almost 50, more than 50 affiliated members of the Center of Popular Democracy in that network. So getting to work with those folks still, and work with folks from Alaska all the way to Puerto Rico on things like healthcare. And at Popular Democracy, I supervise our efforts on immigration, housing, healthcare, defending voting rights and democracy, all of any involvement on Supreme Court and any advocacy there, and then also a project where we do impact litigation, and some of that we were looking to do around healthcare, specifically around COVID.
What's impact litigation? Can you explain that for our listeners?
Yeah, it's like, so for example, if we were to find people whose deceased relatives took to heart the things that people were saying on Fox News, saying that, COVID is just a hoax, it's not a big deal, don't pay very much attention to it, it's just a measly flu, right? That and people died, and their relatives that survived wanted to sue Fox News. That was a case that we were looking for example.
I love that so much.
So that kind of thing, that's impact litigation, right? Where you make a big statement by a lawsuit and you set precedent and you sue a bad person, and it really hurts them a lot. So
we know that the only way to hurt these people is through money. They feel no shame, right?
So for the most part, these people are very shameless, and they're like, well, does it cost me money? And honestly, that's like a lot of times like where we move some of these folks.
Yeah, no, that's absolutely great. I love that you started out in Texas, by the way, which is my new home state. For the past 5 years, I've been living here. And I just think that Texas progressives are the toughest progressives in the country.
They are. It was hard to leave when I left Texas for New York. Like, I had several opportunities to leave Texas, and I was like, why would I do that? I went to school with Canyon Connor, who runs the Texas Equal Access Fund, and we're still in touch. I got to know Marcia, who runs the AFIA Center, and those are two Black women-led organizations that are in the abortion space. Years. And I lived in Texas for about 20 years before I moved to New York. And Texas progressives are special. And where in Texas are you?
I'm in Corpus Christi.
Okay.
Yeah, down on the Gulf of Mexico.
That's right.
We're not calling it the Gulf of Mexico.
We're not doing that.
No, we're not doing that. That's awesome. And the other thing I love about your career is that you've worked in so many fields, and it really demonstrates just how, healthcare is so connected to every other part of our movements for justice, whether it be for wages, voting rights, or housing. It's all connected together. It's all about, making sure that we can live dignified lives,
Yeah. And as whole people.
Yes, absolutely. Yes. So, all right. So let's leap into the topic of the day, right? So one of the problems that I think we run into when we tell folks that we need to defend Medicaid is that we have this really complicated healthcare system. It's designed to be confusing. And so I think a lot of folks don't actually know what these programs are and how much they do for a huge population of people, right? So can you just talk a little bit about give us the first grader explanation of who Medicaid covers and what it does?
Yeah, as a matter of fact, I do have a first grader, and we talk about this all the time.
Excellent.
And her older sibling, when Ivy, my other child, was a first grader, we talked about this extensively, you know, especially since Dad was gone a lot.
Yeah.
So basically, Medicaid covers a couple of groups, or a number of groups of people. One is low income people, right? And that's not just the person who's the earner; it's also their entire family.
Yeah.
And so there's a lot of children there. Elderly folks are typically covered, or it can sometimes be covered by Medicaid. So when the Republicans talk about, oh, we're not going to touch things for seniors, like Medicaid does fund Medicare. So that's one thing that people should understand. And then also people with disabilities, Medicaid covers those folks too. And so pregnant women, and I think this says a lot about the way that we look at women, period. Pregnant women qualify as disabled people. So I think that's really, really, and we should not miss that. We should not miss that, right? So in the eyes of the law, a pregnant woman is disabled. So, and there are other groups, and a lot of like people should also remember that when we're talking about Medicaid beneficiaries, we're talking in large part about children, right?
Yeah.
And that's one thing that we miss all the time. Children, and I think rightfully so, because they're so adorable.
They're super cute. Let's not deny it.
Yes, super adorable. Even if they give you all kind of illnesses, which and I have strep currently. But my children are so adorable. You know, like it's important to remember that's like those are the people that are going to be hurt the most, right?
Yeah.
And I think that there are some things that the Republicans are looking to do, and I think that there are some Democrats, if we're not careful, that might vote with the Republicans. That they're all looking to do that are absolutely in no society at all would it be looked at as like that was the right thing to do. The right thing to do is to take healthcare away from those children, right?
Yeah.
And not to say that the other folks that I mentioned don't deserve healthcare too. Like everybody deserves healthcare.
Right. Yeah, no, absolutely. But yeah, the prevalence of Medicaid and children. Also, I mean, just the pregnant women bit. Like, I mean, it just, especially being in a state like Texas, right? Like, I mean, it's like the right to life, the right to life, the right to life of the fetus until it's born, and then you're not going to cover the mother or the kid.
And also, like we're talking, like if we're being real, like we're talking about ectopic pregnancies too, right?
Yes.
Where like there's one of my favorite artists in junior high said that they don't really give a damn about life.
Yeah.
They you know, it's an Orwellian inversion to call themselves pro-life because they don't care about the quality of life. They don't care about women living. You know, women are just a vessel for them to have more conservative children, hopefully. That's all they are.
I'm really fucking them over by not having kids, and I like it. I like that. It's my rebellion. So, all right. So the reason that we're here talking about Medicaid today, although we really should be talking about Medicaid more every day, but the reason that we're here right now talking about Medicaid is that the Trump administration is fucking evil, and they are about to push through what they call the big, beautiful bill. I will pause now for people in the audience to vomit. And it is going to make around $880 billion. That's almost $1 trillion in cuts to Medicaid. And that is going to include a lot of different things, including pushing undocumented folks off of the program and instituting what they call work requirements. But Jared will break down why that's bullshit too. And so just if this were to pass as is, if everything that they wanted were to go through, what would the impact be? What would it look like on our communities where so many folks are dependent on Medicaid for survival?
Yeah, I think that there's a good number of, so I think that there will be two things. I think one, if it goes through as is, the way the House has passed it, but then two, I think we should also look at what the grand dream of Republicans is for our healthcare system, Medicaid at the center of it, because that's a safety net for everything. So one, you know, that $880 billion number, it's important to note that by itself would be the largest cut to Medicaid ever, right? The other thing to remember is that some of these things, like they're estimates, There's a good chance that they'd be larger than that, and that they would top $1 trillion, just because we don't know the entirety of domino effects, right?
Yeah.
So there's that, and yeah, like they're one, like in certain states. I think California is probably the most popular one where people think about this, and they did it a while ago where they extended coverage to undocumented people. Um,
Right.
right, like that goes away. But then there are people who are children of undocumented people who are documented, right?
Yep.
So
Yep.
those are people that are in that gray area. Like they're probably going to be uncovered, right?
Yeah.
Uh,
Yep.
and I think we also just need to understand the why too. The reason why they want to take $1 trillion out of Medicaid, including uh, taking Medicaid away from their own constituents, is
Right.
so they can fund the deportation machine. And
Hmm.
their bet is that their constituents will be more satisfied with deporting undocumented folks, and some citizens too, as we saw with Kilmar, right?
Hmm.
That they'll be so satisfied with that they won't care about the fact that they don't have health care. And we are seeing in some rural places that are bright red that is not the case. Just deporting people. There's I can't remember what the woman's name was, but there is a big story about a woman who lived in Kansas, and
Hmm.
she got swept up by ICE. And she was someone who went to church with everybody,
Yeah.
that worked at the pancake restaurant, and everybody, and people were like, where is she? Where'd she go? And
Right.
people are like, we voted to deport criminals, but not moms. And it's like, again, like it's just interesting how like woman is an occupation in the same way that criminal is an occupation, or mother is an occupation. It's like it's interesting the way that the patriarchy has indoctrinated us all.
Mm.
So one is pushing immigrants and undocumented folks off. The other thing is what I think it's important that we realize is a job loss penalty, or being punished for losing your job, or
Yeah.
lost your job before. The work requirement, and I think they want to use work requirement because that sounds reasonable if they're trying to fight waste, fraud, and abuse. The work requirement is that 80 hours a month you have to work or volunteer, and every 6 months you have to recertify. Well, recertifying is work in and of itself. That's administrative work that if you had an assistant, you would pay somebody to do that,
No,
because
that's a
it
great
is
point. Yeah.
like, so it's unpaid labor, right? So that's
Hmm.
more work for you to do. So not only do you need to work or volunteer, but you also need to demonstrate that you're doing that. I was talking to somebody because I live, we were door knocking recently, about this issue, and one guy said, "Yeah, some people just don't want to work." And I said, "How many people do you know on Medicaid?" And he named them, and I said, "How many of those people don't want to work?" He's like,
Yeah.
"Well, they all want to work." And I was like, "Yeah, nobody has ever been able to tell me somebody who's on Medicaid that's like, I don't want to work. That's stupid. Work is for suckers." Nobody ever says it's always somebody else, right? Which makes me think that person doesn't exist. That's like
Mm.
that's some figment of right wing of imagination.
It's
That's
an urban legend, very much so. Yeah. Yeah.
right. And so yeah, like that's I think those are things to so if you lose your job, you then are then you get kicked off of Medicaid. That doesn't
Yeah.
make any sense at all, right? Especially when Medicaid is supposed to cover low income people. I think it's also just important, we talked about the why, like why they want $1 trillion. The other why is that McConnell and Ryan, and they openly talked about this the first time Trump got elected, is that they want to end Medicaid as an entitlement. And
Yeah.
legally, Medicaid is an entitlement, right? If you're entitled to something, that is a right, right?
Yeah.
So,
Yeah.
like, I mean, like, let's use the words there, right? So, and the way that Medicaid works right now is, if you qualify for Medicaid, you walk into the office, you show them that you're qualified for it, and they cover you, right? And then the state bills the feds. the way that they want to change it is turn into a block grant, where it's like, well, instead of it being a right, because Medicaid, because healthcare is a human right, instead of the government actually treating it that way, what they would rather have happen is that there's just a set amount of money that they can spend per state, per capita. And then once you run out of that, that's it. That's just too bad. No healthcare for you. It's like, it's like gruel and Oliver Twist, right?
Yeah.
They actually ever ran out of gruel.
No, they had plenty of gruel, but that still they would still withhold. It's the myth of scarcity all over again.
It is. So it's as people who are not able to be covered by prescriptions, it's a lot of like really amazing initiatives. Like when I was at Housing Works, one of the things that we wound up accomplishing was getting the federal government commit to ending AIDS as an epidemic. And every health department, there are about 58 health departments that had to come up with plans and then put them into action. And it involved, in a lot of cases, like thinking creatively about Medicaid and how to spend money, right? And this is, for the conservatives, like it impacts bottom line, because if you prevent the transmission of HIV, then it's cheaper, right? Because somebody's way Medicaid is, because it's entitlement, somebody's got to pay for that, right?
Yeah.
So, I think the last thing that I want to point out is, like, for people doing home health aid, who have home health aides or who have home care, they rely on Medicaid. So it's a lot of people. Everybody is going to know somebody who's going to be impacted by it, unless you're an island and like Simon and Garfunkel talk about. It's going to hit everybody. And then the last thing is that, like, the Congressional Budget Office came out with a number when we were doing the Affordable Care Act fight. And we didn't do that, but other health economists extrapolated that because of the number of people who'd be kicked off of or who will lose access to healthcare services, that about 20,000 extra people would die per year if we had lost that Affordable Care Act fight. What this bill would do, and I think maybe you're going to talk about it, it's like more than 50,000. So the thing is that, Trump has stayed away from talking about repealing the Affordable Care Act because he lost that fight, and he doesn't want to revisit that, and he doesn't want to say anything because
he doesn't want anyone to remember it either.
No, he doesn't. He also, they probably don't, like, they lost. They will lose that. They'll lose that fight again if they try to make it about that, which is why they want to make it about waste, fraud, and abuse. And we're going to cut Medicaid, and we're not going to cut it. We're just going to put some anti-fraud measures in there.
No, absolutely. And then the cumulative effect is this, extra $50,000. God, so disgusting. I'm already thinking about people as commodified. That's what they want. That's what they want. 50,000 people dying. I was looking up and I was thinking, like, 50,000 people is the population of Ames, Iowa. 51,000 people, which is their exact estimate, is the population of Coral Gables, Florida, right? We're talking about if you were to wipe every man, woman, and child in an entire city off the map. That's it. And they get away with this shit, right? Because they couch it under the guise of eliminating fraud, making our systems more efficient, right? Nobody says we're going to kill off Ames, Iowa in order to balance the budget, in order to make sure we can deport more people or whatever.
Yeah. And Joni Ernst just happened to say at a town hall when asked a really good question. She said, well, everybody dies. And she was perplexed as to why she was getting booed right after that. Like, why? It's the truth. Everybody does die. What do you mean you want to live longer?
Oh, honestly, if God wanted us to live longer, he would give us Medicaid.
That's right. Like manna from heaven.
Absolutely. So I did want to get into this whole thing, though, that this whole rationalization, right? Like, the Trump administration explicitly says these are not actually cuts, right? That these are that these are ways to avoid fraud and abuse, right? And that it's limiting the program to quote unquote deserving recipients. And I just like, how do you respond to this rhetoric that only certain people deserve access to healthcare? I mean, it just strikes me, it's like so morally bankrupt, but at the same time, these are people who feel no shame. So how do we respond to that?
I think first we need to understand what's happening there. I think a lot of times people like Donald Trump, and we talked earlier about the Orwellian inversion of pro-life, is that they're, whenever they can, they're trying to turn things on their head. That people who are low income, who have somehow survived in really, really expensive cities, and there are a lot of low income people that somehow survive in really, really expensive cities. Sometimes we're working 3 or 4 jobs, right? That those folks, they don't deserve healthcare. That they're just skating by, right? Meanwhile, like this guy, the amount of money that Donald Trump, if he had just taken the money that he had inherited from Fred Trump and parked it in an interest-bearing account, he for most of his career as a real estate mogul, he would have had more money that way than. So he's actually a business failure, right? So like,
absolutely.
He's a person that's undeserving. He inherited so much money and has wasted a lot of it, right?
I grew up in New Jersey, and we tried to tell y'all. We tried to tell y'all what he did to Atlantic City.
I've lived in New York long enough, and just like the fact that, and you bring up New Jersey, he had a failed casino. Do you know how hard it is?
The house always wins.
How do you run a casino and lose? That should just tell everybody. No, you can't vote for this guy. Like, you open a casino and you lose, you go like, wow, no, you are not qualified to run anything. Like, you can't run a casino. You definitely can't run the country.
So we've got this like abject failure.
Yeah.
He doesn't take care of himself. That's another argument we hear. Like, all these people that not take it. He eats McDonald's every day.
That's right.
Like, I mean, just like, he's an abject failure. Absolutely.
Yeah. So but yeah. So the people so first of all, are we talking about those pregnant women that don't deserve it, the children that don't deserve it, the people who are at end of life and Medicaid is covering certain things? Those are the people that don't deserve it. Again, Medicaid is an entitlement. Healthcare is a human right, and we should treat it as such. There's that, but I think that what they've been successful in doing, because of the way that capitalism works, and because of some of the myths that some of us believe about bootstrapping, which is gravitationally impossible. You cannot pull yourself up by your own bootstrap. Like, that's the deal. That's what the saying. Like, it is impossible. You can't do it. People should realize that.
Yeah.
But the deal is that they really are proliferating again on the welfare queen being turned on its head, right?
Yeah.
That is corporations that are being heavily subsidized. And that these, undeserving people are going to make off with all that free healthcare and use it to buy Cadillacs, right? I'm just going to use my Medicaid card to go buy a Cadillac down at the used car dealership and get rims. It's the most ridiculous thing ever. But yeah, I think we should just understand that everybody deserves healthcare, right? And sure. I think the other thing too is that, like, just remember, like, okay, fine, if you don't believe that everybody deserves healthcare, then remember the children. Think of the children. Think of think of the elderly, and think of pregnant women that need some enhanced health care. And if you don't care about that, just think about how much more expensive, because healthcare, the way that healthcare works, is when you spend money on prevention, you spend money on regular checkups, then that's less money that you have to spend on the other, and somebody has to pay for it. One of the ways that we were able to win a campaign here in New York State on some enhanced benefits for people living with HIV who are low income is that we were just able to prove to them that, like, it is cheaper for you to just pay, like, the way that the law works in New York State, in New York City, it's cheaper for you to just pay their rent. And we're not even asking for that. But it was cheaper for you to pay their rent than to pay for their eviction. And 1 in 4 people living with HIV who were low income in New York State at the time, or New York City at the time, were facing eviction every year.
Wow.
Right.
Oh,
So it was
wow.
like, it's actually just cheaper to pay for their apartment.
Yeah.
Which we're not even asking you to do. The other thing that we showed was that spending this extra money up front on healthcare actually avoids this amount of money, just because it is expensive to die.
It is.
And somebody has to pay those folks. If Medicaid's not going to cover it, and you're just like, then what's going to happen? People have to die somewhere. Joni Ernst is right. We're all going to die, which she is, right? Somebody has to pay for it. We may as well, one, make sure that people are living well by spending money on that. And then two, making sure that we have a safety net that facilitates people, like, at the very least, dying. Right?
Yeah, at the very least. Wow. I think the Right to Die campaign is one that's, just it'll come eventually.
Yeah, that's medical aid and dying. I worked at a lobbying firm briefly before I came to Popular Democracy, and one of my colleagues is working on medical aid and dying. Felt like every year it was going to be close to their year.
Wow. So I guess, when I talk about these things with people who feel untouched by, say, like the Medicaid system, right? So, maybe people who are like upper middle class, the very few rich people I get to speak with in my daily life, very, very few. But when I talk with them and they don't get it, and they've been indoctrinated in this kind of right-wing talking points, I'm like, I kind of get it, like, you've been bombarded with this shit. You've been swimming in this ever since you were born, right? You don't even recognize it. But then, I meet folks all the time who are like, one of my besties here, her neighbor, she lives in an RV park, and her neighbor is on Medicaid, and her neighbor is super psyched about Trump reforming Medicaid. She's like, I am thrilled. She's so excited. She thinks it's great that Medicaid is going to get, more efficient and less fraud, because so many people are abusing the system. But it's not going to affect her, because she's one of those people who deserves it, right?
That's right. Just like the people who, there have been several big time Trump promoters who are Trump promoters on Instagram who've been deported.
Yeah, absolutely.
One of the most high profile Black folks who was stumping for Trump, his friend who was a federal worker got furloughed by Doge, and he was like, wait a minute, this wasn't supposed to happen. And there's I don't know if you're familiar with the social media meme group Leopards Ate My Face.
Yeah.
It is all about just reposting stories of people who voted for Donald Trump, who said he was going to do certain things. He did it, and he was like, I thought you were talking about somebody else. Like, for some rich people, they're like, well, no, now there are tariffs and I can't get anything from Canada. Like, this is like, it's all super expensive. I can't run my business. I thought this was all just going to help. Or the people who are supposed to pick the apples in my field have been all deported, right? Like, that's something that they're all, but for your friend, like, I think there's a disconnect a lot of times that is useful, right? I think it's, so many people buy into this whole idea that they're going to pull themselves up by their bootstraps, that they're going to be exceptional, that they're not the folks who are going to be impacted by this, right? And I do think that there's, like, to some degree, though, a lot of those folks, like, have experienced a lot of privilege just throughout their lives, right?
Well, that's interesting.
Yeah, that they're like, well, I mean, things have always just worked out for me, and I don't buy critical race theory. So, I mean, like, those people are doing something wrong, right? And so, and I'm purposely, using that, but it does happen with people who are who are disenfranchised. Like, there's a phenomenon that happens sometimes whenever a Black person is killed by the police, where the, just in some conversations, no matter who's involved, there are some people that just ask, well, what was he doing?
Right.
And some of it is like, they're like, well, it hasn't happened to me yet. And some of those questions come from Black men. And the thought process well, it hasn't happened to me yet. Is that because I'm doing it right? Is that because like I'm making sure to stay away from certain areas? Or is it just like, and we're all looking for something to reaffirm that, this idea that like the things that we do, that our personal choices are going to impact that. Again, being cisgendered men, we have some degree of privilege, right? So a lot of times the privilege that you're born with does like feed into this idea of like, well, I'm going to be fine. Those other folks, maybe not.
Because I've survived this far, right? So I must be doing something right. Yeah.
It's because I'm doing something right. It totally has nothing to do with with anything else. It must be about me and me doing it right.
Right. Yeah, it has nothing to do with the fact that the only reason that these people want to keep you alive is so that they can exploit you for your labor. And right.
The other thing too, and just quickly, I don't want to lose this, is that in a lot of states, Medicare does not it's not known by the name. Like in Wisconsin, it's Badger Care, and in Oklahoma, it's
right.
Medi-Cal. It's in California, it's Medi-Cal, right? And there are people, like I know people who are healthcare workers in Oklahoma who they will talk about how people in the waiting room are like, during when Trump was trying to get rid of the ACA, they're like, I don't like Obamacare. I want to get rid of it. Sooner Care is great. It's the same thing. Like,
oh, guys.
Obamacare is actually what allowed you to get on Sooner Care.
Oh, yeah, there were those terrible, oh God, like the Jimmy Kimmel interviews on the street, and he would be like, what do you think is better, the ACA or Obamacare, or what do you think is worse, or whatever, and universally, no, I mean, the confusion built into the system, it's really fucking us every day, like,
yes.
Absolutely. So, all right. So these are good tips, though, I think, for how to talk about this thing, because we really need to be talking to our friends, our neighbors, the people who are closest to us. They're the people, even though you might, feel you might hate to talk to your Aunt Sally or whatever, you really, those are the people who are most likely to listen to us, people who we actually have relationships with. So we need to keep doing that. But in addition to having those conversations, what else are we going to do? What are you and the folks at Popular Democracy, what do you have cooked up for us too?
We are going to continue to do the things that we've always done and the things that have worked. I mean, the things that we did back to save the Affordable Care Act worked because those are tried and true tactics. And it's all about talking to elected officials and people with power and sharing your story, right? So if you are somebody who will be directly impacted, or knows somebody who will be directly impacted, spoiler alert, that's everybody, whether you're listening to this podcast or not, that's everybody. And all of us probably have a story to share. If we think hard enough, we have a story to share with our elected officials. And it does not have to be a public story. You can write it and send it in a postcard, or better yet, you can organize a postcard delivery party to your elected official, and those can be anonymous. We did a lot of, at a previous job, we did a lot of where women were talking about their experiences with sexual assault. There are ways to do that anonymously, whether it's a video where there's not, or there's audio script or whatever, right? There are programs that you can get on the internet that are cheap that you can do that, right?
Absolutely.
So and
just the written word, right? Like the written word
there's a written word, and you're seeing a lot of people speaking out at town halls. Republicans were everybody was home and did some town halls over Memorial Day.
If they didn't, we did them for them.
So. Yeah, that's right. If they didn't, we held empty chair town halls. And then also Popular Democracy on the 11th, we're having a large scale mobilization to Washington, D.C., where we're going to walk through Congress and share our stories the way that we did back in 2017, and the way we've always kind of done it, right? So it's going directly to your elected official and the people who have power, and sharing your story, reminding them that they work for you, reminding them that their actions will have consequences. The only thing, you were right earlier, that a lot of times they only care about money, so they care about job security. So if they're in a district where they're feeling the heat, or they're worried about, like, that's the reason, that's the reason why they'll change their vote, because more than anything else, they want to maintain job security.
Yeah, yeah. So tell your story, tell it as publicly as possible, whether it's in person or anonymous, and get as many people to come along with you as possible, right?
That's right. That's right. I mean, people can visit our site at
Yeah.
populardemocracy.org for more information. And I know that you are always sharing lots of information as well about how to get involved. This we've got to save a lot of lives
Yeah.
coming up, and it's a scary fight, and it looks, the numbers look stacked against us. The numbers were way more stacked against us in 2017, actually, when you look at the vote counts. All
Oh,
right.
yeah, that is true, right? Like,
hmm
we've
And the
done
other
this before.
Yeah, we've done this before. And the other thing to remind people is that once, if the Senate passes a bill, then it still has to get reconciled by the House.
Mhm.
And there's a very, very slim margin there. And, the Republicans want to get this done before July 4th recess because they do not want this to bleed over into primary season or local electoral season because they know that this is a losing issue, because they know that this is a horrible thing to do.
Right, right. Absolutely. Yeah, yeah. A losing issue that they are willing, that's the hill they're willing to
They
die
just want they
on
want
every
to do it
time.
as far away from elections as they possibly can, so they can do the thing, do the bad stuff. And they're like, what do you mean? I mean, the news cycle moves so fast that they might be able to get away with it.
Yeah, no, that's true, and people have terrible memories for this sort of
Yes.
thing. Um, so just to like kind of conclude and wrap this up, this is the Medicare for All podcast, so we gotta give a shout out to Medicare for All, and obviously, everyone in this country who cares about healthcare at all needs to be fighting on this Medicaid issue right now. But we know that when we win on Medicaid, I'll say when we win, on Medicaid, we still have so much work to do. We've got to eventually get to a point where everybody's covered and where nobody is segmented into these groups that are easy to pick off too, right? I mean, it's very easy for them to say like, oh, we're going to cut off all those poor people because people in this country hate poor people, including many poor people.
That's right.
And so, we need to get a system where everyone is covered, right? That's definitely true. But what is this fight, being in this fight right now, what lessons does this have for our kind of broader movement, the North Star towards real healthcare justice?
Yeah, I think we have to look where I want to do a through line of where I get my inspiration.
Yeah.
We talked a little bit about privilege and about who deserves healthcare. Somebody that I got to work a lot with is this guy Peter Staley, and if you haven't seen United in Anger or How to Survive a Plague, which centers
Right.
that does one of the things that Peter, who was a Wall Street trader before he became HIV positive, but he thought, he's like, well, I'm a white man. Surely the government isn't just going to stand by and let me die.
Mm.
And a lot of people who were also becoming HIV positive did not necessarily have his privilege. And they're like, no, they do let us die. And he's like, oh, I'm gay. And he not to get too academic, but one of the first high-profile AIDS deaths was Michel Foucault, and he had this theory called
Right.
biopower, and it's just that the idea is that any government is responsible for one thing basically, and it's separating populations into two categories: the make-live category or the let-die category.
Yeah.
And all of Peter's life, he thought he was in the make-live category, and he realizes, no, I'm actually in the let-die category.
Mm.
And the ACT UP movement and the AIDS movement, what they did in places like New York, and it had a ripple effect throughout the United States, is it, in some extremes, like in New York State, in New York City, it moved people from the let die category to the make live category and did it without overthrowing the government. Like that, in human history, that is rare. Like I would challenge somebody to come up, and maybe there are other instances where that's happened without like violent overthrow, that they recategorize an entire population of people, even if it's just New York City, right? Because we have different kinds of rules here. Or I don't live in New York City, or in California where they have different kinds of rules. And there are other states now that because of the success that we had in big cities and all throughout Washington State, right, that there are there are enhanced benefits for people who are HIV positive, right? So if we can think about that and what's possible there, and that's a small number of people actually who are united and would not be divided and had their nose pointed towards a lodestar and were dogged and were determined. They got there. They did the impossible. Yeah. And there's so many things, so many campaigns that I've gotten to work on where people, even sometimes my own bill sponsor said, "You're never going to get this bill passed," and the bill passes eventually. Right?
Yeah.
5 years, Mike. So Medicare for All is one of the, it would have such a positive impact on our society as a whole, right? Like, I don't know if we think about the utopian Star Wars world, Star Trek world that we're supposed to live in. Sorry, I got those two mixed up.
Yeah, the Star Wars world is less utopian.
Yeah, that Star Wars is not. Oh goodness gracious, no. But if one bill that would take us so much closer to that, it's Medicare for All, right? Like just the number of jobs it could create, and how it would really just send a message throughout our entire society that life really is precious and would really make us a pro-life society, actually.
Yeah.
And not in a way that.
Are you with me? Can we reclaim pro-life? Can we do that?
I think so. Like we should totally reclaim pro-life. I think we should get those yard signs up.
It sounds awesome. We should. I definitely want to have you back on the show. We can talk about that some more. We can talk some more about Michel Foucault. I'm a secret Michel Foucault nerd myself.
Oh yeah.
But yeah, thank you so much for being here. This has been such a great conversation, and I think I like you because you're a winner. You've won so many campaigns, and I think that with you on our side, we're gonna have to win this.
I just say I'm lucky. I'm just lucky. I just happen to be in the right place at the right time, and maybe again I'm in the right place at the right time.
All right. I love it. Stay here in this place, in this time. Thank you so much again. I would be remiss if I did not thank our podcast team. Our podcast manager is the lovely and talented Angelique Davis, and our audio editor is the even more lovely, no, not more lovely, the equally lovely and equally talented Craig Stanton. So remember to like, subscribe, comment, and share with your friends. This podcast is a project of Healthcare Now Education Fund, and you can support the pod by going to www.healthcare-now.org and clicking on the donate tab to send us some love. So again, thank you so much, everyone. Until next time, stay safe and stay